Okay, I will be discussing 3 factors that can negatively impact adolescent health and some promotion strategies that nurses could implement to educate teens. Let's go. Hey guys. So, let's talk factor number 1, shall we? Lack of physical activity. So, what happens if you're not getting a sufficient amount of physical activity daily? AKA, what are the negative side effects, right? Well, you're at an increased risk for type 2 diabetes, obesity, cancer, hypertension. Overall, you're just at an increased risk for disease. And adding on to that, it can add to feelings of anxiety and depression. Well, let's flip the script. So what happens if you're getting enough physical activity? Your body will thank you, for starters. It'll be so thankful. Physical activity helps teens maintain good health. It improves bone health, heart health, muscular fitness. It maintains good body weight, and you have social benefits. As a nurse, what can you do? How do you promote this? Well, you need to discuss the benefit and the need for physical activity, making sure that your patient is aware 60 minutes daily is the minimum that you need. And this can be anything. Sometimes people don't want physical activity, or they are afraid of it because they see it as hard work. But if you break it down, make it simpler, saying, it can be chores around the house. You can be picking up your room. That's physical activity. You're moving, you're constantly moving, you're exerting energy. That's physical activity. Start small and then move on from there. You can go for a walk in the park with your friends, with your family. You can even join the local sports teams or your school's teams. There's so many opportunities, so many possibilities. It doesn't have to just be, I joined a sports team or I'm going to the gym. I decided to take my own advice and hop on the treadmill while I tell you about factor number 2, which is insufficient sleep. Boo, very bad. Okay, so we'll start from where we started last time. Why is insufficient sleep bad? What happens if you don't get enough sleep? Well, number 1, lack of sleep is directly correlated with poor performance in school. That is bad for your teenagers because one of their main things that they're doing every day is going to school. Let's see, you have an increased risk of irritability, being forgetful, and then you have depression again. It pops up. It's the same thing with physical activity. When you don't get enough sleep, you have an increased risk of depression. And our adolescents or teenagers, they're getting to the driver's license. So when you don't have enough sleep and you can't focus, accidents can happen. Also bad, very bad. Okay, so I get bored sometimes going forward, so we've switched it around. We're going backwards now. What are the benefits of sleep? During adolescence, they need a lot of sleep, like men 8 hours a night. Why? Because during this time, there's a huge growth spurt that's happening, puberty is going on. They need the sleep so their bodies can function, can continue to grow. Also, sleep helps maintain optimal health. Nurses, how are we promoting this? How are we getting our teens to know that sleep is important? Well, discuss with them the benefits. Make sure that they know they need more sleep during this time to help with their growth. Encourage 8 hours of sleep a night for them to be fully rested. And then maybe setting a bedtime. Sounds kind of childish, but it's needed. So, your body can develop a pattern, and maybe that way they know, like, okay, if I sleep around 9:30, max 10:30, I'll get at least 8 hours, you know? And then prioritizing self over electronics. Your electronics will be there the next day. Set a timer for bedtime, put your phone on Do Not Disturb, and say adios to your friends. They'll see you tomorrow. You guys will go to school together. It's okay, it's fine. Okay, I think this is a perfect time for us to head back to where we started, and we can discuss factor number 3. Wasn't I just talking about sleep? Get it? Okay, so number 3, depression definitely has a negative impact on adolescent health. I mean, it has a negative impact on everybody. People with depression will have an increased risk of suicide, insomnia, eating disorders, substance abuse. Just being in that state, it just puts their body all the way down. So you know the negative side effects, but what exactly is depression? Basically, it's this prolonged feeling of just sadness and unworthiness. It's a serious problem. It affects many teens. It's mainly because during this adolescent period in their lifetime, they spend a lot of time in self-reflection. So they're constantly like over-analyzing themselves, and it causes them to be almost their biggest critic. So nurses, for the promotion strategy for this one, it's a little bit different. It's just a lot of education. You want to educate the teen, and you want to educate the parents on the signs of depression and suicidal thoughts. So that would include feeling hopeless, social isolation or just complete withdrawal, crying spells, there's acting out, a loss of interest in appearance. It's important to know these and have them aware, because oftentimes the signs of depression go unnoticed, and it's just important to educate. Nurses should assess the patient for possible clues of suicide and have a conversation. This is important, okay? This is very important. Listen to understand, don't listen to respond. Oftentimes, they just need someone to listen to them, to really hear them, to not undervalue their emotions, because they're going through something. It doesn't have anything to do with you, but they need you to be there to hear them. Encourage maybe writing in a journal. If they don't feel comfortable talking to somebody, at least write it down so those emotions aren't bottled up inside. And then openly ask the individual if they're contemplating suicide. That is important. It needs to be asked. It needs to be out there. Creating good habits at a young age will promote lifelong wellness, and that's our hope for our teens, for our young adults, to develop these good habits at a young age and carry it with them throughout their whole life. Since this video is about promoting wellness, it is time for me to go to bed. And if you remember, that was factor number 2. Lack of sleep is no bueno. So good night, everybody. Sleep tight.